We should be good to start. Um, I don't know who's starting off with the first slide, but if I wrote the names under, if who has that doesn't mind kicking us off.
Do you want to go to the next slide? So the definition for radical belonging that our group came up with is the active practice by an individual or an organization to foster an inclusive environment for all individuals by consciously and enthusiastically valuing all individuals, regardless of the differing qualities or characteristics like gender, race, disability, or sexuality.
And there are three components to radical belonging. It can be separated into social belonging, professional belonging, and democratic belonging, and each of these are essential components to it.
So social belonging is the aspect of belonging that we described as the ethos of critical care, respect, and appreciation for others. It entails providing spaces, cultures, and communities where individuals are able to feel accepted, loved, and valued for their individuality and who they are. It must simultaneously affirm learners' multiple identities, support those, and this will make people more open to asking questions, to giving and receiving feedback, and that vulnerability increases the flow of ideas shared in that space.
Professional belonging is a collaborative, anti-hierarchical, culturally and linguistically responsive learning. Members' ideas are central to rules of environment and in constructing the knowledge. You want to encourage and utilize diverse contribution of perspectives in professional belonging. You want to highlight contribution outside of normal metrics of success and group randomly and treat equally to encourage hierarchies.
And democratic belonging is an aspect of belonging that encourages collaboration to develop shared understandings of and resistance to destructive or oppressive systems. In addition, to support individuals and help them to collaborate to question the status quo, acknowledge and validate the thoughts of all members, and institutions must equally empower members to participate in the system and have reasonable means to effect change.
So in conclusion, we must foreground authentic lived experiences as entry points for change. Belonging is mutually reinforcing for learning and efficiency. And there's one requirement, which is understanding and communication between all those involved as social actors. Overall, it is more difficult for the marginalized populations to be belonging, and then failure can breed social hypervigilance and expectations of rejection. And there can be biological consequences for the developmentally vulnerable.
So now we're going to go into the interventions that we propose to be made, starting with the organizational level interventions. So one of the first ones that we thought of was raising wages, because when people aren't adequately compensated for their work or they feel underpaid, that can definitely prevent people from feeling that they have achieved radical belonging. So I think with increased wages, staff members would feel that they're more appreciated, and especially when a lot of facilities are understaffed, this would help, because if they're at least being compensated well, then it can help with other factors. So we would want to determine staff that are underpaid and give the staff as much of a raise as budget would allow for. In terms of financial ask, this would obviously require people to be compensated more, and raising wages might require us to make cuts in other areas. And I just found from tax filings that the CEO of Health Fairview received almost 3.3 million in total compensation in 2019, and I just included that to say that there looks like there are some room for places to receive cuts and kind of close that wage gap a little bit. In terms of metrics of success, the success of this can be measured from employee satisfaction and feedback, employee retention, and years worked with the company. And I do believe this is sustainable as long as you're ensuring that the changes you're making are financially feasible. And next, this one can kind of go hand in hand with raising wages. Implementing safer staffing ratios helps minimize staff burnout, which we see a lot of employees are experiencing right now in this pandemic. And we also think that safer staffing ratios will help with things like retention rates within the organization, because when people aren't feeling overworked, they're more likely to be satisfied with their job. And from the implementation standpoint, we can do this one way is by raising wages, because we think that this can make the organization appeal more to people and attract more employees so that we have the means to adequately staff the units. Metrics of success for this, it can be measured by employee satisfaction again, rates of burnout, employee retention, and also patient feedback, because patients can also feel when the staff that's caring for them are understaffed. And along the same line, I think this would be sustainable as well, and also scalable across all professions within the organization.
Another one on the organizational level that we came up with would be to have a cleared code of ethics for the staff. So the purpose of this is to create a standardized approach to establishing radical belonging in the workplace. And in order to implement this, leaders and representatives of the organization would need to meet and decide what core values the organization would follow or want to focus on. And I think it would be important to also include what behaviors would not be tolerated. And we can have everyone sign off that they have read the code of ethics, and also put up posters and brochures around the workplace to remind people of the organizational core values. And metrics of success for this would be employee satisfaction and feedback. Leaders can also report back if they've gotten complaints of people not following the code of ethics. And whether this is scalable, all healthcare settings and organizations could benefit from this. Just think it would be important to make sure we come back to it and revise it as needed. Another intervention would be education or tuition reimbursement programs. This would be to allow opportunity for upward mobility within the organization. And the key implementation step would be to create a program that allows staff to make progress within the organization. So metrics of success would be employee retention rates and satisfaction, enrollment numbers in the program, and then this could be used in all healthcare settings as well.
Next, we're going to go into some team level interventions for this healthcare group. One of the first things that we brainstormed was this idea of dynamic unit surveys. There is a need for us to establish lines of communication and evaluation with staff to assess and trend members' thoughts and feelings in response to interventions in general workplace culture. We also want to create new accessible lines of direct communication so that we can identify new areas in need in the future. So part of this will be to designate an individual or team to create, administer, and interpret surveys with content specific to their units, specific to the interventions that are taking place in those teams, and specific to that culture and of belonging and being within that space. This survey content will be reviewed and updated frequently, and the frequency of administration may vary depending on the ongoing intervention and can be left open to that individual or team, whether it wants to be done monthly, quarterly or directly after certain procedures or other things take place. This financial ask is not so much because surveyors could be promoted through internal review rather than hiring a dedicated team member. However, in the event of a large team, responsibilities may be distributed amongst these designated team facilitators on each unit. They will collect and process surveys digitally that will require an initial setup, but afterwards the system is stable, easy to change when needed, and won't require too much financial resources inputted after the initial build. For metrics of success, these will be in themselves measuring any kind of outcomes, frequency of complaints, how often they're resolved, feelings if team members can affect change in the workplace, if they feel included in team decisions, and then we can use some more abstract and objective measurements like employee retention, years worked with the company, and just survey response rate amongst the general staff. And this is an easily scalable ideas, as we'll go into shortly, that we'd like to use these dynamic unit surveys to correspond with a greater interprofessional team that can share ideas and share questions and outcomes between each of the survey dates. This is an example of one such survey, things that ask questions regarding if they feel encouraged to come up with new ways of bettering the workplace, if they feel personal accomplishment or satisfaction, if they feel they are being productive, and a lot of things that are important towards measuring employee happiness.
We also thought that it would be a good idea if we use these surveys that we'll be sending out and be analyzing the data that we collect in an interprofessional team setting. Purpose is really to create a forum for open communication amongst all interdisciplinary services to analyze these survey data. Now, the key implementation steps is to designate an individual or team to create, administer, collect, and interpret surveys along with presenting the information at these meetings. We would then select representatives for each interprofessional service. If a service only has one member on the team, then he or she is that representative. But if a service has greater than one member on the team, we designate one of those members as representative, and we would select that by internal review. We would then schedule monthly meetings, either in person or over Zoom, where we would conduct these meetings. So the financial ask would be to compensate the person who is a person or persons who are interpreting the surveys. We would also compensate the representatives for their added contribution during these meetings. And then in addition, if this meeting was to occur in person, we would try to have we'd have to compensate for the food and refreshments that we would have. But if it's over Zoom, we would not have that. And long-term financial ask might be, if this program works successfully, to have a full-time team leader and coordinator. The metrics for success would be how often complaints that are presented at the meeting are resolved. Also, the amount that team members feel heard and feel that they can cause change, as well as rates of employee retention. And lastly, we do believe that this is scalable not only to an individual team, but multiple different teams and on an organizational level. We also thought that another good idea would be work-related training sessions. Purpose is to prepare for critical events in a multidisciplinary setting. For example, if a specific team needs more training in a particular type of skill, like running codes or placing chest tubes, this would be a great collaborative opportunity for people in the team to work together to practice this in a non-life-threatening scenario. So the key implementation steps are to coordinate with the Department of Medical Education or external services to organize training sessions for specific scenarios tailored to that team. And then each quarter, we would decide a specific topic or scenario for training, as we talked about, like running codes, emergency chest tube placements. And we would leave the nomination of topics to a public vote or to leadership. We would divide team members into groups and schedule each group to attend one of the training sessions scheduled weekly. We would get approval from management to make it so that attending these sessions gives you CME certification, and or also make it paid time to encourage more attendance. So the financial ask for work-related training sessions, we would pay training organizers for 1 hour per week for training sessions. We'd pay them 1 hour extra pay to everyone who attends a training session, or we could also have to pay for space and equipment costs. For the metrics of success, it would be speed of task completion, both how fast and also how much we can decrease the speed as much as we can to become more efficient, the level of miscommunication during task scenarios, how comfortable each team member feels speaking up in a scenario, how well a team member perceives they know their role in these scenarios, and how well team members perceive everyone else knows about their role, and also patient outcomes following related procedures, as we'd want to see how these work-related training sessions affects real-life patient care. And we do believe that this is a scalable project that can occur in multiple different teams and even on an organization level. We also do feel that this reduces stress of members within marginalized communities and identities, because it allows individuals who may not come from well-experienced centers to get up to speed training with those who do have significant experience, and doing so in a collaborative, non-life-threatening scenario.
We also think that on a team level, they would benefit from the organization of professional non-work related events that are dedicated to fostering team rapport through inclusion and encouragement of self-expression. While those work-related events are very useful for procedures, there's a lot of ways in which we feel that members of each individual team could better express and share themselves and their individuality in a way that could foster better support and engagement from team members amongst each other. Some of the key implementation steps would be to decide on topics for these social benefit functions. They can be voted on by surveys and can include things like charity events, volunteering opportunities, picking nonprofits such as charities for like adopted kids, social gatherings of any other kind, but all to have some kind of volunteer or charity aspect that can also be included as a method of team building in supporting other nonprofits. We can designate a coordinator per team, and we should make sure that we're scheduling events regularly and encouraging participants to bring and include family members. Some ideas for such could be joining a 5K as an organization and paying for all team members and their family members entry fees to participate. The financial ask is not going to be a lot because most events will be charitable and tax deductible when designated under these means. Vendors and food cost could be possible for some events. But we can fundraise for such things or allocate wellness funds from the institution because these are meant to better the health of our employees. Some of the metrics of success could be things for general employee satisfaction, like attendance and tardiness rates, call-outs, resignation rates, satisfaction and happiness scores, workplace and company culture ratings, but also how much do individuals enjoy working there, how much do they feel their charitable interests are included, and just a general enthusiasm via total number of suggestions for each topic. And these can also be successful ideas that are scalable and shareable through the interprofessional team that will meet and share their survey results and information regularly. You're muted, sorry.
Another idea that we had was the wall of appreciation. The purpose of this is to encourage team members to recognize and appreciate the hard works of their colleagues. And how we would do that is we would designate one wall specific for this wall of appreciation, an area that's easily seen by everyone. We would place post-it notes and markers readily available near the wall. And we designate one portion of that wall for patient gratitude letters that can be put on that wall. So the financial ask is very minimal. It's just the cost of post-it notes and markers. And metrics of success would be general employee happiness and satisfaction. We do believe that this is very scalable. And we think that this would be a good program to reduce stress of healthcare members with marginalized identities, because it allows other team members to show gratitude towards these individuals for their unique skills and contributions, and also helps these individuals know that they are being appreciated for their efforts.
Sorry. And finally, some smaller ideas meant to hold up team members and booster support and recognition amongst those units. We want to recognize and reward those who exemplify the values of belonging in their teams through an incentive and recognition program. This could be done by creating public submission for monthly or quarterly nomination by all members, or we could even nominate or limit nominations from smaller groups within leadership to make sure that employees know that their efforts are being recognized directly by those who are over them. The financial ask for this is hypothetically a monetary prize, $500 quarterly times 1 year is only up to $2,000 a year per team. It's a small amount in terms of the overall team budget, but could go a long way towards making our employees feel appreciated and towards making a difference in their lives. For metrics of success, again, we're going over any kind of satisfaction or happiness metrics, and if they feel that our organization is consistent rewarding the values that we outline in our mission statements. And also the size of participation pool for nominations could be seen as enthusiasm. And this would be very easily scalable to a larger organizational level. Finally, we think it might also be helpful to provide further accessible means of equitable inter-team communication and debriefing through small group discussions that are regularly scheduled. These could be based on topics for discussion identified by employee survey, by leadership recommendation, or by public nomination. Alternatively, we can open up the general discussion on topics such as wellness, stress reduction, or provide open forum for questions with leadership. These really need to be scheduled monthly or quarterly for regularly check-ins, make sure that our employees know they have direct, regular communication and ways to access and air their grievances with the higher ups, or just ways to make sure that we can provide for their wellness and mental health if there are any challenges like COVID who are facing our workforce. Finally, these financial asks is pretty small because we can offer hourly pay to employees for attending these sessions if they're quarterly, only 4 times a year, or possibly provide food and catering to encourage participation as well. Our metrics of success, again, are employee stress levels, satisfaction and happiness scores, and feelings about the level of contribution to the team, and if they feel like their strengths are being utilized appropriately. And this, again, can be scalable through sharing successful ideas and presentations amongst the interprofessional team.
Next, we have our individual level interventions. First, we have employers can provide individual-based training modules that can provide education, training, and time for self-reflection to individual employees concerning the meaning of radical belonging, how to identify implicit and unconscious bias, and how to incorporate radical belonging into both the workplace and their everyday lives. An employer would have to create active learning modules that are engaging and easy for the employees to access. And then financial ask would be the cost of creating and maintaining the microlearning platform. Metrics of success would be percentage of individuals that complete the modules, as well as responses from the individuals of the helpfulness or interest in the modules. And it would be scalable because other organizations and institutions could use a similar platform or model. Another individual intervention would be lunch with other team members. Individuals can address their own biases by talking to new people. For implementation, you just have to pick someone new to sit with during lunch and then learn a little bit about them. Financial ask would be cost of buying your lunch or none if you bring your own. Metrics for success would be personal reflection on the experience and any eye-opening revelations as a result of it, and it would be scalable for teams or organizations could host lunches on a larger scale.
So the other thing that we were thinking about for individuals would be a thank you or appreciation survey. So individuals will be given a link to a survey to be filled out by the end of their shift. They're encouraged to write something encouraging or nice about a fellow coworker or someone they're thankful for. And the purpose is to create relationships, a sense of belonging, and welcoming environment. The financial ask would be the cost of time spent filling out the survey. The metrics for success would be starting a conversation and how it can be measured by how many people filled out the survey. And it's scalable because teams across the hospital can incorporate this and even talk about another healthcare professional in the hospital. And then finally, the strengths quiz would be the individuals in the organization will complete a quiz to discover their strengths and how to apply them to their everyday workflow. After taking the quiz, then individuals will meet with their managers or advisors to understand how to utilize them and their strengths most effectively. The individual can then feel like they're being used the correct way and not losing any value in doing work. And for financial purchasing quizzes may be expensive for new hires and once a year. However, it could be thought that the cost is rational as production should see an increase. Consulting with outside sources for managers could prove to be expensive. Strengths allow workers to feel like they're being used in the correct way. You want to check quarterly for production output and amount of work to be done per day. And it's scalable because teams across the hospital can incorporate this and even talk about another healthcare professional in the hospital. And they could also be put into upper management situations as well.
So overall, we found that this exercise in developing strategies to improve radical belonging at this healthcare facility were a little difficult to find ways, especially for the given vignettes of workers across different spectrums of professions. But we do feel it is possible to make changes at each of these different levels to support and improve the sensibilities of workplace culture and belonging in a way that can improve not just outcomes for patients, but the overall happiness, satisfaction of our employees, of their teams that they belong in, the organization to which those all belong, and hopefully in the end should go a long way towards affecting patient outcomes and improving overall health and the care that our patients receive. Does anybody have anything else they'd like to add? All right, well, we appreciate the time, and we're going to end the recording now. Thank you.